Hi, this is Dr. Khosroabadi, and today we are talking about complications that happens during the lengthening process when we are treating brachymetatarsia or short toe syndrome. Today we're going to be talking about metatarsal lengthening and one of the most complication of metatarsal lengthening, which is the jamming of the joint. Here I made a model of the foot and trying to mimic the toe and the yellow area that you can see here that represents the joint, which is the fourth metatarsal phalangeal joint on this foot. And also these two strings represents the tendons that stabilize the toe, which every patient has. And also the way we normally did install the external fixation, which was 2 sandwich clamps on each side of the osteotomy. As you can see, the bone is cut here. There's 2 pins to the bone in front of the bone cut and 2 pins in the back of the bone cut. And these 2 clamps will start separating and lengthening the bone. But one of the most common complications with this construct was that we were able to lengthen the bone, but the joint over here would start jamming, meaning there would be a lot of pressure in the joint where these 2 bones will come very close to each other to a point that at some point towards the end of the lengthening there would be no joint space, and at that point we would be most likely performing another operation to release the joint, because these patients after a lengthening could not move their joints. It was not possible for them to go up and down as they did before the surgery, because this bone was lengthened and would be the head of the metatarsal would be butting against the base of the toe, so there would be no joint space at the end of the lengthening. So I'm going to demonstrate how that happens and what I do now to prevent this from happening and save the joint from arthritis and contracture to a point that it would prevent this problem from happening. Here I have the wrench that normally we use to turn and separate these 2 clamps so it can lengthen the bone, but I put it on a power device so that way we can speed up this process so you guys can see how this happens. Normally this happens very slowly because we're only turning about 0.5 millimeter a day. But for the purpose of this video, we are using a power device and turning this rapidly so you guys can see what happens to the joint. The tendon at the base of the toe is very stable. It's holding the toe in a very stable position, so it doesn't go to the sides or up and or down. So here I'm going to start turning. And as you can see, the little yellowish area is starting to jam more and more and more and more. Now we have had this much length, and look what happened to the joint. These 2 bones are completely touching each other at this point. It has squeezed the joint to a point that there is no space. These patients are unable to move their toe up and down, and we call that usually subluxation of the joint, and if it's not treated it will become an arthritic joint because there is so much pressure on the cartilage where the cartilage starts deteriorating and pretty much dying out, and this area becomes very arthritic.